All right, this is Dr. Theodore Henderson with Neuroluminance, bringing you our special topic today is ADHD. You know, it's a funny thing about ADHD is like when I first started in medicine, it was unusual. It was, 15%, 12%, 8% were the numbers that were thrown around. We sort of settled on 8% of kids have ADHD, but now it's more, and it's being diagnosed in adults. But there's only one problem. ADHD is defined as I can't pay attention, I have trouble concentrating, I have trouble organizing, and I'm impulsive. If you have a traumatic brain injury that affected your frontal lobes, guess what? You can't concentrate, you have trouble paying attention, and you can't organize things. If you have an infection that affects your frontal lobes, same thing. If you have toxins that are affecting your frontal lobes, same thing. If you have depression that is making your frontal lobe degenerate and get thinner, you can't concentrate, you can't organize, you can't make decisions. So ADHD in some ways is a garbage pail term in the sense that several different things can lead you to the same spot. One of the things that we're discovering about multi-watt infrared light therapy is that it can help ADHD tremendously. So I'll give you two examples. One is a 12-year-old boy who did badly on any of the stimulants. He'd lose his appetite, it'd mess up his personality. And it's exactly what every parent fears. What parent wants to put their kid on a stimulant and give them a stimulant every morning? Nobody. But who wants to do that when their kid's personality literally changes because of this medication? So mom said, let's give this a try. And he got 10 treatments with multi-watt infrared light therapy. And we did some psychological testing before and after. The Stroop colored word test for all you geeks out there, which is a really good test for ADHD. He did terrible first time. We also did a written comprehension test where he had to read some stuff and figure out what we were really asking and some complicated questions. Grammatical reasoning, he did terrible on that. After 10 treatments, guess what? He did a whole lot better. And you can see it here in the graph right here, how much better he did. And then look at how much better he did with the grammatical reasoning. So he's gone off. That was years ago, 8 years ago. He's now heading off to college. Doesn't have ADHD. I'll give you a second example. One of our patients came to us for treatment for long COVID. He's a dentist. He had all fatigue and brain fog, and he had a tremor too. Last thing you want is a dentist with a tremor, right? Not a good thing. So he was desperate to get this taken care of. And so he came to us and he got 20 treatments of multi-watt infrared light therapy. And oh, by the way, he also had ADHD. He had ADHD his whole life, and he took Vyvanse for it, a stimulant. He pulls me aside one day and says, Doc, this is weird. My Vyvanse is making me jittery now, so I stopped taking it. And here's what's really weird, Doc. I can focus just fine. And in fact, to this day, a year and a half later, he doesn't need a stimulant anymore. His ADHD symptoms are gone. And the other interesting thing is, he used to take a benzo every night to go to sleep, something to relax him. Benzo is sort of like alcohol in a pill, not necessarily a good thing to be on your whole life. He doesn't need that anymore. So his anxiety is gone as well. So what we're talking about here is the idea that ADHD is in fact an injury in the brain. And maybe the injury is a genetic injury for kids who are born with it, but it doesn't mean we can't change it. So wrapping up for today on that very exciting topic, and next time we'll tackle another really interesting topic, and I'll geek out again, I know you put up with it. But any questions, any comments, please reach out to me. Dr. Theodore Henderson with Neuroluminance, signing off.